hopefully you have had a nice experience with Panagiotis Pamidis, just to tell about our master. And now my topic is today. I'm Outi Ahonen, I'm principal lecturer here in Laura University Applied Science in Finland. And my topic here is promotion of digitalization and its related operating method, skills and culture in Finland. And firstly, short something about e-health in Finland. All healthcare services are using electronic documentation here in Finland. The electronic prescriptions in used all over the country, so you can't use paper versions. Digital services are implemented largely to healthcare. Social services are increasing the electronic documentation and digital services. Then we have national Kanta services, and they are a set of digital services that store citizens' social welfare and healthcare data. The use of this data makes it easier to manage affairs relating to citizens' health and well-being. People can see their own data, and data can be seen between different service providers, mostly. And I thought that this is something, a sort of background information for the topic what I will tell you. So I was the one of doing investigation last year asked by ministry. And here you can see the objectives of this investigation. The topic was clarify the current situation regarding the solutions, experience and need of healthcare organizations related to development of digital skills among healthcare personnel and digital capability of work communities. The investigation will focus on various ways to promote the necessary digital skills during work throughout peer and local support, as well as effective methods and make significant progress in digital capabilities, digital skills and the culture of development. The investigation will also explore what kind of collaborative and networked working methods we could use and benefit as the whole nature as in Finland. Thirdly, we produce a handbook about the topic. But now I would like to tell you the investigation and how it went through. My colleagues were Merja Tepponen and Tuuli Turja. Tuuli is working in university and Merja is on healthcare side. We made the data collection, and of course there was previous literacy, then there were survey, interviews and workshops, and there you can see the number of ends. The collection, we start with the collection. It was in March and May, and responses were received from 19 different countries around Finland, and respondents were aged from 20 to 68, so there was large age difference. The mean was 47. Most of the respondents were women, and the higher education they had, on 77% had the background information. Mostly the respondents were nurses, but there were a large amount of different kind of professionals, and this healthcare other means that there's some IT background behind them mostly. So the overall whose answers were in this survey, they were over 718, because there was some of we needed to drop out. And the main idea from the survey that the respondents reported 62 of them primarily doing client work, and 16% had supervisory duties, and 9% have leadership responsibilities. And 61% had digital client work as part of their role. Among them, the majority, 69%, felt that in-person and remote client work were in suitable balance, and we thought that that's very good results. Just under a quarter, about 23% felt that digital service represented too small parts, so they would like to have more about digital services under their duty. 8% thought that there were too many digital services in their client work. Then we had these interviews and workshops, and interviews from each welfare county, so it's all over the world, in Finland, and the expert from national level. So we have the national offices, and there were universities and University Applied Sciences. And then the total number of interviews, there were 85% were from welfare counties and 15% were from this other experts part. So mostly these topics are from welfare counties professionals. And most of the interviews represented nursing professionals, and those nurses, they have master or doctoral degree quite largely behind them. There were also background from social work, 17% of them, 10% were medical background, and they're also remote doctors, so they also had the commitment to the digital services. Other professionals also in interviews and workshops, you can see here that there was the engineers, business graduates, and communication experts. So, and the total in these workshops, we had over 200 participants. And that work we done on last spring, and was catered this framework to self-assessment of digital skills by social and healthcare professionals, as well as the evaluation of the entire work community's digital capabilities by management and experts. And here you can see these topics where we were phrasing the framework and health and social care professionals' own experience of digital competence and digital capability on the work community, assessed professionals, management experts. The situational picture and assessment went through that we started digital competence and readiness for change in work communities and the need of training. And here we marked the health and social care professional views on digital competence and capabilities. So information management, data-driven leadership, monitoring health and well-being, online guidance and interaction, ethical competence, systemic services and service systems. Then we add the questions related to AI, how to utilize AI, and various sections of the survey. Additionally, interviews contained questions about the use of AI, and workshop, there was one topic about AI in the one workshop. In addition, the interviews included a section of the management and development of digital competence, and then there were a dedicated workshop about this network model. In other workshops, knowledge was deepened and best practices for digital competence and capability in welfare counties, as well as they found, promote, and accelerate the expansion of digital services and motivate professionals. So as a situational picture, we go through like this. The average assessment of online digital competence and digital services presented by specific areas of digitalization in social and healthcare sector. So you can see that when the mark was 1 to 4, there was very high level of importance on all these sections, and most important, they felt that was this ethical topics, and informatics. Maybe a bit lower was online interactive and guiding as a topic. Also, their competence, how they felt that their competencies were online interactive and guiding were a bit lower than example informatics. And we thought that there can be also that people can sort of familiar, very understandable what is interactive and guiding. So it's more easy to understand what I should understand and what I should know than example informatics or knowledge management. There was also seen that like a primary nurses, they felt that their competence a bit better than example doctors. And we thought as researchers that might be that primary nurses have very concrete task to do. An example doctors has large permit and they can understand the needs of knowledge management and all these topics more largely. Then conclusions about this, that social and healthcare professionals feel that digitalization has maintained a meaningfulness of work and balance between traditional digital work methods. A suitable amount of digitalization, functional balance between remote and in-person services, along with a predominantly positive view of the work community's digital readiness, illustrates how Finland has succeeded in digitalization of the social and healthcare sector. On the other hand, the level of competence among social and healthcare professionals varied. Interviews estimated that about 1/3 of the staff had deficient digital skills. There were a large gap with the basic skills, and then also people with has huge, important and strong expertise demanding areas. But then on the general level, the capacity has been improved. So that was good knowledge. Conclusions, differences in social and healthcare services that strengthen of social sector. The social sector, there stands on digital customer service skills, ethical digital competencies, and digital society skills. As a society skills, we think that there is a lot of people who can't use digital services so well. So there is these skills how to help people to support them to use digital services. So maybe that's the also strongness of the social sector. The overall use of digital services and social services was lower, and they had used digital services less than healthcare. But in the social services, there were also some new advanced models like child welfare offers, which are very supportive and strongly developed. Information management competence was a knowledge management competence considered more important in social sector. Healthcare has longer experience about management, information management, and they have long traditions to use it. Also, we thought that developing, these came out in interviews, that developing person-specific reporting models can bring new opportunities. Looking forward for that. Training needs. There is greater need for informal training than formal training. And informal training means that you can really have fast to increase your competence during the work. And short-term workplace training is necessary and can be supported, for example, digital coaches and mentors. So it's hugely important that you have those coaches near in every work unit, not so far that you can't have their support when you need it as a professional. And they have special role and therefore could have broader expertise to utilize and close support coaching and training to work communities. In Wellbeing County's personal competence development plan is also important. So it's important to have the plan how we can increase every professional skills and capabilities during digitalization processes. Also in AI, of course, there is the same kind of need that you need to have more competence about that. A basic training of staff, how to utilize AI assistance in their work, because you can use it already, or adhere to the ethical standards. So ethical standards were getting very high importance when using AI. AI training, like digital training, is needed both in general terms, but also organizational job descriptions and system-specific training. So in many kind of ways to train people to get the best possible solutions. Leadership. The role of leader and supervisors is considered very significant in the adoption of the expansion of digital services. Leadership structure, management, commitment, leading by example, ensuring resources and enabling an experimental culture is very important. Also resourcing, because we have lack of manpower. It's very important that when the digital services requires manpower, then we need to, as an organization level, also find out the ways where we can reduce use of manpower. So in such cases, it's good to have the best practices already found in national level and utilize them, of course, in international also. And work community culture, it's one of the very, very important topic. And the culture of work community is the attitude of staff and management, and available support significantly impact digital competence. There was the one answer from one interview that he said that old attitudes and practices are so difficult that they actually hinder the development of sensible operations. So us as developers and professionals and managers, we need to really think about how we can cut these old attitudes and bring new ones to us. And we know that culture changes slowly, and they slowly down the adoption and spread of digital services. Operational phases are difficult, so it's important the leadership can visible commitment for management discussion and the importance of experiential culture, and crucial increase in digital transformation. So leaders in the workplace has very important role. There's new roles also when we are changing the the way of work, of course, there comes new roles. And there was the need for new types of roles, and create as organization renew their services and service processes with digital services. Example, the assessment of care needs in the assessment service needs, and there's a lot of digital support persons and digital mentors, and that they can be in mostly every work unit. And this between ICT and operation, the one of the answers was I can articulate what is needed and understand both the operational side and the technical side to certain sentence. So like Panagiotis Pamidis just told you about our master as a manager, we hope that these kind of persons we will educate in that management master, that they can sort of talk ICT language and also healthcare language, they're both. Conclusions that work models also, that the primary healthcare reception services, there were various work models for digital services. There are nurses assisted receptions, hybrid receptions, in-person reception side by side, and alternative full-time remote receptions such as front lines of digital health centers, multidisciplinary receptions where nurses, social workers, physiotherapists, for example, is also invited doctor reception situation. There were also the so-called flow model, where guidance was based on the urgency of the client's needs, and there was staff's expertise considering personal works and multidisciplinary teams. So think about what is urgent and what is not so urgent. And there is on the side is the topic where the one doctor says that it's he prefers use video-based consultation, remote consultations when he knows patients better. So likely to use those kind of patients, the remote consultation. About special expertise needed for online guiding and interaction skills. We have the interaction like face-to-face or chat-based, and chat-based is unique way to communicate, and that also needs expertise. Also, as a chat-based, you can have, example, 6 channels at the same time, so you are talking with the patient, 6 of the patients same time with the chat, so that needs professional new kind of competence as a decision maker. Also, face-to-face online interaction, you need to have technical expertise enough to manage and then of course the health or social care competence to interact with the patients. Then quite nicely, one nurse said that professional says that they are more deeply in contact with the client or participant, patient during the remote consultation. It feels like they are more closely connected than when they are face-to-face. So I think this is very important to understand. It's remote sessions are not so weak. They can be very strong if needed. Example for good practices, centralized home wellness technology and remote call them. And there's encouraging what kind of needs, encouraging leadership skills, close support, new work roles, a mobile digital support team, so that there's all the time digital support when needed, that they get get readiness for distribution situations. So it's important to handle the technical situation. The impact reduce home visits, travel times, and long-term costs, and improve staff availability and service requirements advance. And there's also that suitable for some particularly able workers. So example, the nurses who have some health problems by themselves, they might be have a good possibility still work as a distance course. Medication dispensers and other sensor technology is one of kind, and that's also help, and it's getting even it reduced the time of nurses, and it's gets more safety even to clarify the medication. Co-development procedures.
We have a few minutes left.
Thanks. I will go. Yeah, thank you. And then I will go. These development processes, they are very, very tight. I will jump some of these pictures just to go to the one of the important. Here, when we were discussing about the produce, how to produce learning, there's non-formal, informal, and formal, like we had this manage this process. It's important that we in workplaces we define that what kind of non-formal education we have, and in educators that we are having definition of the competence of what is needed, and then to have a tight discussion between non-formal and formal educators, that how we can make these non-formal and informal contents the part of the education. Here, I wanted to have you show that needs-based approach and impacts. We decided to have that one of the core is competence renews the working life in social and healthcare sector, and working life renews competence. So it's need very highly important part to have discussion between. And in network, how we will define the network, it's important. I will show some of the recommendations what we set. So we had the recommendations for the all actors, and it's important that it's also international network, but also in the phase that we get with the small steps. So we don't need to take the large step, even small step go by one-to-one. And then national actors, they need to have digital regulation. So it needs to be regulated, and there need to be definition for digital skills in the national and EU level. And there need to be funding through that. And networks are important. And there was the one, what we succeed now in Finland, that there need to be a lot of networks work with educational institution and social and healthcare sector, that we can create our work together. The recommendation for middle and top management welfare, I pointed here that we draw from inactive processes. So it's very important that we can see what are the good processes, and we need to get the array from old processes. And then recommendation digital developers and competence experts in well-being counties, that we should have the national materials in the internal training and digital mentors to everywhere, and sharing best practices. And for every personal, of course, they need to increase their knowledge, but also be brave and make initiatives, because we think that the healthcare professionals can best see the way how to change their own work. So it's important they have courage to them to find the new solutions. And then institution providing training and the social and healthcare sector, it's also important that we will have the educators very strongly connected to this topic. And the last, thank you for this time in here in Athens. And if you have future questions, please email me. And if you are more interested than the strengthening interoperability and equality digital health with Nordic Innovation Conferences in Helsinki next autumn. So warmly welcome. I stop sharing, Mariana.
Thank you so much, Outi, for this great enlightening presentation. Any questions for Outi? Well, I have a few questions, a couple of questions. First of all, are you aware of any initiatives of the Finnish, and initiatives in Finland bringing together educators from formal and informal learning?
Yeah, we have. It's starting, but there are those their first tries. We also have funding instruments which are trying to support that we will find those topics which are part of the healthcare professional everyday life, and how we should sort of create them as a part of the official formal learning. So that's processing continuing, and that's so micro credentials are part of our EU work.
Great, thank you. And also it was surprising to see that 89% of the respondents were women. This means this depicts also the workforce, or was it the respondents rate, and maybe it has to do with the literacy of the respondents?
Maybe there was also there, of course, there are large amount of healthcare workers are women also, but there was also that the greatest amount of answers came from in survey came from nurses. But in healthcare, the women are quite large group, and I think it's very important to understand that we need to educate, like nurses, they are most largest group in healthcare, so we need to educate them and get them through and work actively with digitalization. That's the way how we get the digitalization really next to our patients. So there are many kind of works what nurses and doctors are doing together with the patient, and there are a lot of women.
Thank you, Outi. There is a question. Let me share the microphone.
Hello, my name is Mariam. I'm from HIMSS. Thank you so much. It was really interesting to hear about all of these masters. One thing that really strikes me that you spoke about the digital literacy in the social services. And I have not seen or heard a lot of discussions about how to also build the digital skills in the social services in a lot of countries, especially that a lot of us kind of know that as we advance the digital transformation, a lot of that is going to bring the social sector and the health sector together in the integrated care models, hopefully, in the coming years. So I really want to commend you and really appreciate what you have done here. And if you can just reflect a little bit about how you actually merged those two skills, the digital skills in the social sector and the health sector, and what type of profiles of people come from social services that actually might be a good fit for that master's or for what you are doing. Thanks.
Is it Panagiotis, are you willing to answer, or should I answer?
Well, there's a section on social partnering right after. Okay. We are going to comment on that. So if you prefer, we can have a short discussion afterwards at the end when we also hear the students.
Yeah, okay, about the students. But then if I talk shortly about social services and welfare services and in healthcare in Finland, we have tried to combine them even more and more. Of course, there are different laws and regulations, but still we try to have for them as a patient and customers as a smooth services. And there are research in Finland, and there are development that digital services are coming also to the social services, and they are doing it a lot. But they are a bit back from the healthcare, but they can use all those. They don't need to go struggling every healthcare service topics what healthcare has, so they can learn from healthcare and go maybe more fast to the same situation where healthcare is for now. So they are coming and doing hard work, and it's all is possible to also work with welfare services.